Hello everyone, my name is Rachel Prashant and this is my presentation that was prepared as part of the HAP 725 course on Statistical Process Control taught by Professor Farouk Elami at George Mason University. This presentation is intended to discuss the performance of Duke Health Raleigh Hospital on multiple indicators when compared to its competitors. The source of the data is from the data.cms.gov website. The hospital compare archive datasets from the years 2015 to 2020 were used to analyze the performance of the hospital on a quarterly basis. Patient safety and access to quality care should invariably be prioritized for effective process improvement in hospitals. This case study examines patient satisfaction at Duke Health for measures such as discharge information provided and overall rating of the hospital. Other measures studied are 30-day mortality rate for stroke, 30-day readmission rate for acute myocardial infarction, and occurrence of serious blood clots post-operatively. There are certain limitations to this case study. First off, data was not available for every hospital and for every time period. Second, some values reported discrepancies. And finally, this study was conducted with a possible 5% error rate. The hospital I chose for analysis is Duke Health Raleigh Hospital, located in Raleigh, North Carolina. Duke Health conceptually integrates the Duke University School of Medicine, the School of Nursing, the National University of Singapore, the private diagnostic clinic, and incorporates health research programs at the Duke Global Health Institute. The hospitals I chose as competitors for Duke Health are the University of North Carolina Hospital located at Chapel Hill, the Wyden Medical Center at Greenville, and the WakeMed Raleigh campus located at Raleigh. The rationale behind choosing these hospitals is their proximity to Duke Health Raleigh Hospital, and they just about serve the same population. The blue line in the control chart indicates the performance of Duke Health, while the red lines indicate the control limits of the competitors. In examining patient satisfaction at Duke Health Raleigh Hospital, we first evaluate if discharge information was provided. We observe that the patient satisfaction score falls in between the control limits of its competitors, indicating that variations present here are similar to its competitors. As we examine the overall hospital rating, we see that the overall rating for Duke Health has consistently stayed within the control limits. So when compared to its competitors, Duke Health does not perform better or worse than them. The third control chart shows that the mortality rate of stroke for Duke Health is above the control limit with a downward trend since October 2017. When compared to its competitor hospitals, Duke Health has a significantly higher mortality rate of stroke. The rate of occurrence of serious blood clots after surgery for Duke Health was above the control limit till May 2018 and drastically decreased since then, indicating that it is improving in performance for this measure. Here we see that the 30-day readmission rate of acute myocardial infarction for Duke Health was below the lower control limit and then displays an upward trend and falls back within the control limit, indicating a lower readmission rate when compared to its competitors. To summarize, Duke Health generally displays similar variations as its competitors for discharge information and overall hospital rating. Duke Health has a lower rate for 30-day readmission of acute myocardial infarction when compared to its competitors. The rates for occurrence of serious blood clots after surgery, although higher initially, is now within the control limits. However, Duke Health has a higher stroke mortality rate when compared to its competitors, and this is an area of concern that should be looked into. Thank you for watching this presentation.